And instead of someone sitting down with her, explaining to her that that was perfectly fine and that there's an incredibly wide range of male appreciation for variations in the feminine form, which is definitely the case, she developed the belief that if she couldn't be, Kim Kardashian, she'd never be an acceptable woman, or certainly not an ideal woman. So, and the notion that it's also very interesting to speculate about why the delusion that puberty blockers, hormone treatment, and then surgery is going to be an easier route forward. The idea that people take that for granted is also an indication of stunning diagnostic and assessment insufficiency. Because I talked to Abigail Schreier in detail about the horrendous complexity of full surgical transformation, which first of all isn't possible except in the shallowest possible manner. I mean, you can build a man a vagina that will function badly for sexual purposes, but it has none of the other functions of the actual parts. And it's as if we've reduced, this is something I find particularly reprehensible, it's as if we've reduced the concept of woman to whole usable for sexual activity, because nothing else is transformed in the surgical procedure. And that's a pretty damn shallow definition of what constitutes a woman. And to brandish that in front of desperate young people who are confused beyond comprehension as a solution to their psychological problems, well, that's why I wrote that essay, Butchers and Liars. It's so perverse that it's almost incomprehensible. And it's a miracle of a negative sort that we've actually got ourselves in a situation where this is not only the standard of care, but it's the mandated standard of care, because across jurisdictions across the Western world, increasingly, if you're a therapist and you don't affirm someone's identity, which could certainly mean within the first 3 sessions, then you're actually on the hook for professional malpractice. And so that's just a jaw-dropping transformation in standards of therapeutic care. And it's interesting to see how that came about too, because it came up, at least in part, as a consequence of legislation that was hypothetically designed to stop so-called conversion therapy, which was the therapeutic practice that a tiny, tiny minority of people used many decades ago to try to convince gay people that their orientation should and could be transformed. But virtually no therapists, certainly no therapist I ever met in my life, practiced that.